let me run this by you. I don't know what your thoughts are on this subject, but
Mhm.
do you think that there's a problem with gynecology? Sometimes I feel like there's a gap somewhere between gynecology and fertility. So like on the one hand, you have gynecologists who are the first point of reference for most women, and
Mhm.
then they send them straight to a fertility clinic. I can't tell you how many women I've met who have said something like, I didn't know I had endometriosis. I didn't know I had PCOS. I didn't know that fibroid was going to cause me trouble. No one told me. And then they're 37 or 39 years old. And for me, I'll say it in my own words, for me, I feel like maybe in the olden days, maybe not today exactly, a lot of the problems could have been solved with gynecology being more proactive on fertility and reproduction.
Yeah, so I think that stems from a lack of training and education. So OB/GYN residency is 4 years, and there's a pretty wide range of things they need to cover. The biggest thing that they need to do is deliver babies safely and be able to do pelvic surgery safely. So the vast majority of training is focused on that. Now, believe it or not, there's very good training programs where gynecologists get really good exposure to fertility, but a lot of programs, especially if the REI education it comes from a private practice, the exposure is very limited. And there's actually very limited training on the reproductive physiology. So if you ask a gynecologist to describe the menstrual cycle for you, a significant proportion of them can't. And so when they talk about progesterone and when they talk about estrogen, and if you think about if gynecologists can't, then primary care doctors and internal medicine doctors, and then they certainly have a paucity of exposure to that. Now, I'm not saying that's everyone. I'm just saying that if we're going to pinpoint where the issue is, that's probably where it is. And so um, I think you have a problem getting answers and getting a proper evaluation and treatment because of that. And a lot of them are certainly capable of ordering a basic evaluation and maybe doing some initial management, but that in-depth discussion may be suboptimal for that reason.